what
So we've got certain people in the community who are Ugandans, who are Zimbabweans, but decide to isolate themselves.
Yep.
Now the tip is, when you isolate yourself from the wider community, you're isolating your children, you're isolating your grandchildren. However, when mayhem comes running to you, and I always say this, and someone once said, Masawa, you don't have to say it. These are the same people, when they pass away, the police will ring me probably and say, Masawa, as a leader in your community, this person seems to be Ugandan. You'll identify them and say, yes, they're Ugandan. They will still carry your body and bring it back to the Ugandan community. Oh. We will start finding money to ship you back where?
To your country.
To your country.
Oh, yeah.
Home. But you've isolated yourself and your family from this community that provides identity. So for example, in the community we live in, we have Uganda community, Luo community, Teso community. It brings cultural intersection into these groups. You say you've visited. We bring people from Uganda to talk to our children about culture sensitivity, who we are, even if they are born there. Uganda, they come and sell gomezis there, so our children can know their culture and their background. Now you've isolated yourself from this identity to a community that even doesn't call you their own, but identifies you as an immigrant. So you have a red passport and your child will always be an immigrant. You have a red passport and even if your child is mixed race, they're still identified as black. Even when they go to school, the mental health and well-being of our children of color is basically trauma, because a white child will say to you, your skin is dirty, go and have a shower. But you had a shower. So those things that are traumatizing your children will not be shared in the community. When you come into the community, some of these groups that we do and lead on as association, as the nurses at the moment. So personally, these are things that I do myself, despite being in a system that money is not the problem. Number one, I did say that I'm a parent as well. We spoke about childhood, child upbringing in a country that is exposed, in a country that has everything, in a country where a child can have an iPhone Pro Max for very limited money. So as parents in a system that is not supporting the needs that we have, how are we educating ourselves to educate our children? Because one of the dilemmas of mental health and well-being for our parents is when a child demands and you cannot basically put an end to that demand. You mentioned something about a need and a want. So my oldest is 22 years old, born and lived in the UK. She clearly understands the need and the want. That is how I have brought her up. She needs to take responsibility of certain things. If I give you a meal and a roof under your head, you've basically received a need. A mobile phone, that is a want. How do I educate you to understand that that is a want? Because as a midwife or nurse who works in a system where you're not paid, once your child understands that, that is a bit of stress taken off you. In what we call low-income countries, because trust me, in developed countries, there's always a backup for us. We've got certain problems in developed countries, but it's nothing to do with money. It's nothing to do with the lifestyle we live, because I was just telling my colleague here that you will never know the gap in terms of finances between people, because people even get benefits. So people get free houses, people drive cars when they don't work, because the government has put a system in place to support an income of somebody. We have something called payments gaps. We know that somebody must get a certain amount of money for what they do. So you'll never find our nurses, doctors, and midwives or allied professionals wounded for money. However, for the rounds of made in hospital and where I am at the moment, we have to think about the pay gap for people who save our lives. and where that frustration comes from. Reverend, I can tell you that in 2017 when I came here, I met interns in one particular hospital who were coming to work every single day. They had not been paid their intern fee, but they were on duty every day. I met nurses who were saying to me, Madam President, we've not been paid for 3 months, but they're doing their job. They have to pay tuition for their children, they have to buy food, at home, and they have people who rely on them. All our parents rely on us, but they can't afford to pay the needs of their family, and yet they come to work every day. So trust me, when you see this midwife saying, Sapo Tumayo, it is the frustration that she's coming into hospital.
Because they are planned kids. Okitegeera bwe buzibu batugenda ofuna maaso oyo omwana ali planned kid alema okwachivinga obulamu bwalina okwachivinga atuuke maaso eyo yeteekemu omugwa. So a top to bottom approach of a government, then bottom up approach introducing a mental health school clubs because that's how you tackle awareness. Kati ebintu ebyo ebimeetinga wano wakati in the middle, they gain momentum. Kubanga ojagenda musomero ogere ku mental health awareness ng'abaana already bakimanyi, ojja mu parliament ogere ku mental health awareness ng'aba ministers already bakimanyi. That is how you push the government okwongeza ku budget ya mental health. It used to be 1%, someone kati yangambye it's 1.5. Naye kakati tweyongerako tutya okuva ku 1.5 eyo okulaba nga services zino ziri accessible nga we twogedde. Ndowooza eyo yeeteesa yange mu mbeera eno. Thank you.
Thank you.
But psychotherapists were good referral hospital. Ne PCOs. Bayina direct link naga amasomero getukolagana nabo. Ne bano ba counselors ne school nurses mwaga amasomero. Bayina direct link yawa yeggulu. Mental health clubs zino zibeera facilitated by the students themselves. By students tubasomesa kyetuyita mental health first aid. That means nti omwana w'essomero wanalaba munenga alina depression or stress obanga alina seizures, omwana agudde afunye seizure ku ssomero, tebagenda musekerera busekerezi. Okitegeera lumu nali nkola n'abaana in UK ne mbabuuza, what do you call someone who is paranoid? Omwana yanziramu a psycho. Kati omwana ng'alina stigma eyo mu kusomero gwe bayita psycho, bw'afuna epilepsy n'agwa ekigo ne bamusekerera gundi yagudde ekigo. Twagala okuyigiriza abaana abo first aid, ba facilitators. Nga bw'alaba ekintu ekihappenize kumene abeera nekyo tuyita empathy. Naye ng'asobola okuki-identifyinga n'aki-reportinga wa school nurse oba counselor. School nurse oba counselor bw'alaba nga takisobola, tubawadde skills ezisobola oku-identifyinga crisis. Awo waakulira owa regional hospital PCO, clinical psychiatric officer, n'amugamba nti nina crisis mu ssomero, omwana ono ayogera ku suicide. Is there an intention to commit suicide? Is there depression in a severe way? Nti omwana ono yeetaaga eddagala. Do they need more than I can offer nga counselor? Eyo ye communication gye twetaaga between services. Then ministry yennyini eya education okuchallenginga amasomero okubalaga standard operating procedures ezikwata ku mental health and well-being in schools. Kubanga abaana baffe baba bagenda okukola exams, they're under pressure. Even day-to-day life, omwana omulala ali mu kulya G, omulala yaguze muwogo. Those things abaana badde babyogerako wano by the parliamentary camp. Abazadde tubitwala for granted. Omwana omulala alina omwana ayogedde wano nti nnyinza okusaba mamange iPhone Pro Max nanga atalina ssente, naye buli wagenda abroad alinya first class Emirates. So try to help me understand lwaki tompa iPhone Pro Max nga gwe otambulira mu first class of Emirates. You're traveling an expensive way, but you're not buying me an iPhone Pro Max. Tulina okuyigiriza abaana baffe to process the value of the things they want in life. Mu Uganda ne mu regions mwetambudde, bwetunatandika okukola the rights, bwetunatandika okufuna data tools ezicollectinga the right statistics, tujja nakwekanga because it will be worse. Okimanyi nti nno nze ekyalo kya jjajjange kiri Sembabule, omwana alina mental illness Sembabule tali ku data kuba ayinza okuba tagenda nkwena mu regional hospital muwa diagnosis, naye ali ku street atambula akola ki? Alya kasasiro. mwami wange ava mu kyalo bakiyita paminyaye which is in Gulu, Pabod, Amoro. Abantu abo nabo bali ku statistics. Nja kubulira nti omwana wa committinga suicide ng'ava mu ebyo ebyalo. Okimanyi nti bamuziikirawo ku olwo olunaku tewaba naddamu kyogerako because of stigma.
Exactly.
Kati omwana oyo ali ku statistics ezo. So I want to challenge you nti mu abantu abali mu challenging statistics ezo mujja kwekanga nga statistics ezo tuzikoze right ng'ate ziri even worse. Kaakati we ngamba top to bottom approach, government yaffe call to action erina okuteekawo processes ezigenda oku-aligninga mental health issues into ministries. Kati tulina issue ey'obulwadde bw'omutwe mu masomero at this moment in time. Tulaba abaana bakommittinga suicide, abaana balina low resilience levels, abaana tebakyamanyi problem solving, abaana balina peer pressure system engeri gyekyuse kale ebintu bya education byonna bikyuse. Tulina gap the rich are really rich, the poor are really poor. Never not tusomera amasomero gegamu, okitegeera. Naye government yaffe erina okutandika okwalininga policies nga zivi Ministry of Health na Education zirina okukwatagana. The policies have to speak to each other. Wetugamba nti we are launching mental health clubs in schools. Ministry of Education ekikwatiddeko waawo ekyalayininze etya ne Ministry of Gundi, Ministry of Health. I'll give you an example. Mbadde wano kati maze emyezi 4 naye ndi Gulu tulina amasomero 5 ge twakutteko okulaunchinga mental health clubs mu masomero. Twakwasaganye ne Gulu Referral Hospital. Erinnya lyange nze musawo Justine Nakimuli Kigozi, Mrs. Odwongo. Era ndi president w'abasawo n'abazaalisa mu United Kingdom. Ate era nga academic profession yange ya psychiatry kyetuyita obulwadde bw'omutwe okumalira ddala emyaka 23 nga mbadde mbikolera mu UK, nasomera mu UK era gyenkolera. Kati tubadde ne wiiki eno kyetuyise mental health camp ku parliament wano, naye theme yakyo yabadde bridging barriers to access to mental health services in Uganda. Biki ebitugaana okugenda okusaba obuyambi mu services zaffe wano mu Uganda. Ye bannaye ekintu ky'obulwadde bw'omutwe tukitegeera bulungi ffe ng'abana Uganda. Kati ekintu kino ombuuziza okukola ka summary naye omulanga nze gwenku buli wembeera nga njogera about mental illness mu nsi yaffe eno Uganda nti ekintu kino kirina okubeera ne top to bottom approach and then a bottom up approach. Top to bottom approach kitegeeza tikiviira ddala wali mu balidazi baffe abali mu buyinza okutwala nti obulwadde bwa mutwe bannange is not a joke. Singa bwe twalina COVID-19 tugijja kuba mu crisis ekintu kino kifuuke nakyo pandemic. World Health Organization etubuulidde ate ennaku zino ne statistics tuzirabye tukola ki zeeyongera. Omuntu omu yangamba ennaku ezo but Madam President statistics zino zivaawa ani azicollectinga tool ki ze bakozesa collectinga statistics zino. Naye namugamba nti embanya mental health and well-being ate eya Uganda ngimanyiiko yadde nkolera mu UK kubanga I'm deeply involved in the Ugandan community eri neewano ne Ministry of Health ng'endamu.